This is going to be the winged technique. So to streamline this video a little bit more, I did already put my ligature on. So to remind you, the ligature is a safety component. Just in case the clamp pops off the tooth, the patient has the opportunity to swallow or aspirate. So I tied that on already. And I've already punched my holes. So this biggest hole is going to be for number 31. That one is the clamp tooth or the anchor tooth. 30 is the tooth we're working on, and then 2 in front of that. We have 28 and 29. Those are just extra support teeth. So for the winged method, what we're gonna do is we're gonna get the little wings inside of the anchor tooth hole. So I'm gonna stretch the clamp, or stretch the dam over the clamp, and now it's ready to be placed on the patient. So now we take our forceps. I'm gonna turn this around a little bit. Get that ready to go and move this over so you guys can see exactly what I am going to be doing. So I have my whole piece built and ready to go. Now I just have to find the appropriate tooth to place. So this is going to go on tooth number 31, the last tooth in the arch on the bottom for this patient. Now that I have the clamp on the tooth, the dental dam frame can go and hold up this rubber dam while I work on the rest of the dam here. This again is to help keep it out of the patient's throat. It helps keep this nice and taut. A really good support method here. So now we are going to follow the same steps as the wingless technique. We're going to try to stretch these holes over the appropriate teeth. And we will tie a little piece of dam ligature towards the front so we can get that nice and supported. Try to get the dental dam over the teeth here. And try to keep that down. So I'm going to cut that ligature now so we can have that to help keep the front part of the dam in place. So cut a little piece of the dam off, stretch it nice and tight. I'm gonna floss it in between those two teeth there. So that's between the last tooth that has the hole and then the first tooth that is covered. So I'm gonna get my floss here. I'm gonna try to floss all this dam down in between the teeth. Even this front one, we could try to get that down a little further. Okay, I'm gonna use the T-ball burnisher to help adjust some of this dental dam. Try to push that down a little further. Get that in between the tooth and the gum tissue here. One thing that I didn't mention in the previous video, you guys as dental assistants cannot place a clamp. You can do every other part of the procedure minus placing the clamp on the tooth. So when we do the skill evaluation, I usually let the student choose the method if they want to do winged or wingless. Meaning for the winged technique that I would place the clamp and then the student would place everything over it. Or you guys can kind of get this together and then I place the clamp and then you can do the rest of it. So there's two different methods, two different ways to do it. Students usually prefer one or the other. So now I'm gonna get you a little closer and now we wanna get this dental dam off of the wing. So this front one here will be a little bit easier to see. So I just popped it right off with the T-ball burnisher. We're gonna do the same thing on the lingual. Pop that around and under so there's no chance of saliva or anything leaking through. So dental dam, nice and secure. Everything's in place. Now I can go ahead and take this apart. So the procedure is done. First thing I'm gonna do is evacuate any debris. So I'm gonna use the HVE, suck any material out from the inside of this dam as possible. We're gonna take out this ligature, grab our scissors. Again, fit your finger right underneath of here. Try to pull that away, and you're gonna snip the little pieces that were in between the teeth. So that will help remove that from in between. I'm gonna get my finger, pull on the lingual surfaces here, just so we can get some of that dental dam out from in between the teeth again. Now we can grab our forceps. You guys can remove dental dam clamps, just can't place them. So this is something you guys can do. I'm gonna place my forceps over. We're gonna try to pull this dam out in one piece. Next step here, I'm just gonna check the dental dam to make sure that there's no pieces left inside of the patient's teeth. Regardless if there are or are not pieces stuck, we are going to floss just to be sure. So we're gonna floss in between every contact here that the dental dam was placed. So flossing, nothing is coming out. I will bring you over to show the dental dam piece here. So this looks like everything was intact. Even if it's intact, we are still going to go ahead and floss.